Hello guys and welcome back to my channel. My name is James and this is the Med Guy. Today we're going to be doing sepsis and septic shock. We're going to be discussing what it is, how do you diagnose it and how you treat it, and especially all the things that you need to know so that the next time you deal with a patient with sepsis, you'll know what to do. So like 100 BC, there was a guy who said that sepsis is kind of like when the infection gets into the blood and then just goes everywhere. He was pretty much spot on because that's exactly what sepsis is. It's when there is an infection, and the infection is most commonly in the abdomen or in the chest, so a pneumonia or some sort of infection in the abdomen or the abdominal, and this is then gets into the bloodstream and moves around. Patients who are diabetic, or patients who are having long hospital stays, or patients who are having major surgery are quite susceptible to sepsis. Ugh. The number one killer in hospital, or the thing that kills the most people in hospital, is in fact sepsis. So it is quite a significant burden on people in general. So the stages of sepsis is kind of where the septic shock comes in. So the first stage of sepsis is when there is an infection and it gets into the bloodstream. This then releases like cytokines everywhere, and then there are multiple clots throughout the body, and these clots are what cause the decrease in organ perfusion and decrease in nutrition getting to where it needs to be. So stage 1 is infection in the blood. Stage 2 is when the brain, heart and kidneys start to dysfunction because they don't get enough oxygen or enough nutrition, and so you have your organ dysfunction. And then in stage 3 you have your septic shock. So now you have sepsis that is causing shock. So now you have hypotension. That's what shock is. Shock is hypoperfusion. Fantastic. I actually made a video on shock. Then what are we going to do about this, or how do we diagnose this? So there is something called QSOFA, which is your quick sequential organ function assessment. And what this is that they look at your blood pressure, they look at your breathing rate, and they look at your GCS. So if you're less than GCS 15 sort of thing. So what this is a quick assessment tool to assess how bad a sepsis could be or how at risk someone is of sepsis. It isn't actually a tool to diagnose sepsis. The benefit for us in terms of pre-hospitally and in hospital, and the reason why people like this QSOFA, is because it is a assessment tool that doesn't require you to take bloods. So it's quick and it can be just done on the bedside or on the patient's bedside, whatever. What are we going to see in someone who is septic? So they will be pyrexic, they'll have a temperature, they can be hypothermic, they will have a tachycardia, they will have a tachypnea, and they can be hypotensive. That's, the shock part of it. How do we treat this? Well, we need to give fluids. We need to give like 1 liter or 2 of fluids before we can really say it's septic shock. And then we can then give them inotropes. The inotrope of choice is noradrenaline. We started a dose of like 0.01 milligram per kilogram. It's pretty low, and then we can go up to about 0.3. There are other drugs you can use. I have made a video on inotropes up here. Check it out. It's really interesting if you're not quite on top of your game with inotropes. And then the other treatments that we're going to be doing is we're going to be doing blood cultures to assess what kind of bacteria it is. We're then going to start our antibiotics. We can give corticosteroids. We're going to be putting them on your inotropes like we discussed. You're going to be trying to find the source of the infection and then solving the source. You need to find the source of where this is coming from. And then you're going to be, taking these patients to hospital, or they are already at hospital. So guys, I hope you did enjoy this. If you guys have ever dealt with any like severely septic patients or septic shock patients, I'd love to hear about some stories below if you have any questions. Thank you so much for your time, and thanks for watching, and we shall see you in the next video. Bye for now.